Good afternoon. This is the Iowa team and on the Maternal Health Innovation Grant, and we are talking today about our Seatbelt Safety Program, which targets pregnant and postpartum women. I'm Stephanie Trusty. I'm a nurse for the Iowa Department of Public Health, and I am working on the Maternal Health Innovation Grant. I also participate in um, the maternal mortality review as a data abstractor, and I am on the Iowa Maternal Quality Care Collaborative team. Dr. Radke.
Yes, and my name is Stephanie Radke. I am an OBGYN and I practice at the University of Iowa. I also serve as the Quality and Safety Officer for the Iowa section of ACOG and am a co-investigator on our HRSA State Maternal Health Innovation Award. And Steph and I are part of the leadership team for the Iowa Maternal Quality Care Collaborative.
So we just wanted to acknowledge the HRSA State Maternal Health Innovation Program. They help fund our work on this project. And this is just a slide to acknowledge them as our funder. Next slide. So we want to talk a little bit about this data to action project that we did using data from our maternal mortality review committee and their recommendations, and also partnering with our Iowa Maternal Quality Care Collaborative committee, which identified this as one of their initial projects. We did work with multiple stakeholders through this project, and they were key in the success, and developed a social media campaign. So that's what we'll be talking briefly about today. Next slide. So our data from our maternal mortality review in Iowa showed that this was a leading cause of non-related, not specifically pregnancy-related causes of maternal death. And that is true for Iowa, that car crashes are a leading cause of non-pregnancy related maternal deaths, and it is true for both Iowa and nationally. 18% of Iowa's maternal deaths were from motor vehicle crashes. And what we were shocked to find is that 71% of the women who died were not restrained. They were not wearing seatbelts. Next slide. So the stakeholders that we partnered with were the Iowa Department of Transportation. They also received grant funds, and that program is called Zero Fatalities. We also partnered with the Governor's Traffic Safety Bureau, which is always a politically correct thing to do if you have a governor's bureau, to include them in your project, and we were happy to do that on our project as well. And Iowa Safe Kids, Blank Children's Hospital. And each of the partners brought different things to the table that were extremely helpful. The Department of Transportation Zero Fatalities, they already have a Facebook page. They had connections with social media campaigns, and had done and developed those campaigns previously on texting and driving and other seatbelt related initiatives, and participate in on the national level. So they were a great partner, and they also have funding in addition to our grant funding that is going to print some of our print material. The Governor's Traffic Safety Bureau has links to our governor's office, and also they have their own website where they can share materials as well. And the Iowa Safe Kids Coalition do the child safety seat checks in Iowa. And so they are already going out into communities all over our state to provide education on safety seats and appropriate restraints for infants and children, and they provided us with some funding to support the social media campaign, as well as they're going to help with outreach of our brochures, giving them out at their sites. Next slide. So, in order to develop our social media campaign, we had to come up with some key messages. And so, the messaging that we came up with was pregnant people should wear a seatbelt. Buckling up through all stages of pregnancy is the single most effective action you can take to protect yourself or your unborn child in a crash. One of the things I learned from our community stakeholders is they do not use the term accident, which is the one I have always previously used. They use the term crash because they believe that if people are appropriately restrained, most accidents can be avoided. And so they use the term crash. So that is intentional. If you're involved in a crash during pregnancy, even a minor impact could have a major impact. So contact your healthcare provider and never drive or ride in a vehicle without buckling up first, no matter where you're seated. Some of our postpartum deaths were women that were in the back seat. The infant was appropriately restrained and didn't die in a crash. The mom presumably was trying to calm or maybe a crying baby. Certainly that's something I've done before. Next slide. So we did work with those stakeholders to develop a social media campaign. We wanted to include in the campaign our data. So you can see on the left side of your screen, it included your baby is only safe when you buckle up. And we did include our data that 18% of Iowa maternal deaths were the result of a motor vehicle, and our actual ads that went out said crash instead of accident. And that it was 18% of the women that died from crashes, and that 71% were not wearing a seatbelt. These went out in a method that whenever someone got on the top social medias for our age group of clients, and they searched for any pregnancy related topic or infant related topic or stores that sell baby and infant items, then a pop-up would show up in that social media platform with one of these two messages. And Dr. Radke is going to continue for us.
Thank you. So the second component of our program is distribution of an educational flyer about seatbelt use, which is developed specifically for pregnant people by the National Highway Traffic Safety Administration. This flyer is available to download off the web, and the link is here in our presentation. Our initial plans, as we've discussed, are to distribute this to birthing hospitals, Title V agencies and WIC offices, as well as prenatal care providers, with the hopes that they will incorporate this into any sort of educational packets that they provide to their patients during prenatal care. You can see these flyers here. And it covers both the correct positioning of the seatbelt while pregnant, specifically noting that the chest strap should go above the uterine fundus and the lap belt should go below. We also like how it includes additional information about safe positioning of the seat, as well as use of airbags while pregnant. And finally, as noted, the flyer highlights the importance of seeking medical attention immediately if a pregnant person is involved in a motor vehicle crash, regardless of whether they were the driver or passenger, and regardless of whether or not they perceive that they might have an injury. Our campaign was announced with a joint press release between the Iowa Department of Public Health and the Iowa DOT. This also resulted in a radio interview on a local station, as well as recognition by the American Association of State Highway Transportation Officials. Our immediate next steps for this ongoing campaign, including enhancing distribution team, is working to develop an additional brochure that would be specific to seatbelt use in pregnancy and postpartum, highlighting some of our statistics here in Iowa and likely mirroring the images that were created for the social media campaign. Our seatbelt safety working group also came up with many other innovative ideas for distribution of these educational materials, including having seatbelt safety for pregnant people highlighted on the interstate digital banners in our state, distributing flyers and posters at various driver's license sites. And as mentioned, the Safe Kids Iowa program that certifies car seat installation is going to be distributing our flyers at their events as well. Finally, we intend to ask our collaborative partners to utilize our social media materials on their website and promote them on their own social media pages. We've also considered a second targeted social media campaign using these materials that have now been developed to run in later years of our grant funding. We have some additional plans to dive deeper into seatbelt safety or seatbelt usage to better understand some of the drivers of behavior. As Steph mentioned, we have some ideas ourselves, with many of our team members being mothers. We have some thoughts about why sometimes women may not be buckled, especially in the postpartum time period. But we really want to make sure we're not making any assumptions about health behavior. So we intend to work with our community advisory board, which we have for our HRSA work, to develop a survey based on the health belief model and the theory of planned behavior that would help us to identify some of the key driving factors of behavior around seatbelt usage. We hope to recruit survey participants via our patient and family partnership social media platforms, as well as through our public health agencies, with the goal that the information that we'll learn via this survey project would help to inform our key talking points around seatbelt usage and potentially allow us to refine our message in future years. We also plan to monitor receipt of education during prenatal care around seatbelt usage. Our Iowa Department of Public Health distributes a survey to newly postpartum mothers called Barriers to Prenatal Care, which is administered in the hospital prior to discharge. Approximately half of people who give birth in Iowa complete this survey, so we have a pretty good response rate and very high numbers to look at. We are planning to add a question inquiring about education about seatbelt use was received during the care, which will help us to understand if there is uptake and utilization of our materials. Finally, we will, of course, continue to track motor vehicle fatalities in our maternal mortality review committee, and especially continue to monitor use of seatbelts amongst those who do suffer a motor vehicle crash. Thank you so much for listening to our session on our seatbelt safety campaign here in Iowa. Please don't hesitate to reach out to us at our email addresses listed on the screen if you have any questions about this program.